Good morning, friends. Welcome to our next learning session. And today I am going to talk about what is known as thimble bladder. You probably may not heard about thimble bladder, but you might have heard about thimble. So what is thimble? Thimble is a small hard cover made of metal having lot of small pits in this, and it is used by the tailors to stitch clothes with the hand using needle and thread, and to push the needle this small cap is used. See how it looks like. You might have seen it or not seen it, but it is very simple thing to know about it. See this is the thimble. This is on the finger. This is the thimble. It is pushing the needle. This is the needle. This is the thimble. These are the small depressions on the thimble. This is made of metal, and the bladder, when it becomes of this size, then it is called thimble bladder. Now at this moment I also want to tell you one thing more about it. Is this diagram. See this diagram, and see what you see in this diagram. You see these are kidneys on both sides. This is of course diagram to teach, therefore it is cut open to show the inside of the kidney, and this is as a whole you are looking at the kidney. These are the two large vessels present in your tummy. This is the on the right side. This is the big artery called aorta. It is coming from arising from the heart, going up in the chest, taking a turn, making a arch, coming down and passing from the chest into the abdomen. It is called abdominal aorta, and accompanying it is another large vein. It is called inferior vena cava. Now see, but that is not our important point. See this. See this channel with where my pencil is moving. See this channel. See this channel. It is going here in the bladder, and similarly here there is another on the other side is also a channel coming from the kidneys. These are two channels which are bringing urine from the kidneys. You know the urine is formed in the kidneys, and from the kidneys it comes through these two channels called ureters into the bladder, where urine is stored, and then as the urge arises, it pushes the urine out through the penile urethra. So this is the portion shown going out of the body. This is the portion from where urine will go out. Now this is what we are talking about bladder, and this becomes a thimble-like small bladder. So friends, it is the incidence of 206 when I was working in Lions Kidney Hospital and Urological Research Institute. One very senior urologist referred me a case of thimble bladder. He asked me to take care of this patient, and the findings told to me were that this patient had the complaint of inability to hold urine. This person was a senior urologist, and the patient was a male, 45 years of age, married, had two sons. The major complaint was inability to hold urine. The patient was non-diabetic. His urine culture did not show any abnormality. The biopsy of the bladder showed evidence of tuberculosis. Standard anti-tuberculosis treatment was started, which consisted of rifampicin, ethambutol, Isonex, and pyrazinamide. The patient responded to the treatment, and I continued with a patient continued to come to me for follow-up, and patient showed improvement. But here the question was how to rectify his inability to hold urine. So for this, again, we need a specialist type of surgeon. These are called urologists, and particularly those who work on reconstruction of bladder, or this is also called augmentation cystoplasty. Here the operation consists of making some sort of arrangement by which the capacity of the bladder can be increased. And in this patient, the surgeon took a piece of the small intestine called ileum and cut it open, stitched it with the sides of the bladder which has been given a cut, and the whole thing now becomes a large pouch of small intestine. The urine comes through normal channels and gets collected in this patch of ileum along with the bladder. Bladder hardly has any capacity, is about 10 to 15 ml, which is nothing as compared to the half to 1 liter capacity of the normal bladder. So this operation was carried out, but after the operation the patient had some other complaints. Patient complained to me that he is passing some mucus in the urine. So I explained to him that a small piece of intestine which has been used contains mucus glands. The ileum has mucus glands, and this mucus is coming from the ileum. It is no disease actually, but when these glands degenerate, this will stop. And this is what happened. After some time, his mucus stopped coming out. Then he came with another question to me, that he feels very much tempted. He was of course young, so he said that he wants to do intercourse, but he is afraid. So I sent him back to the surgeon to take his opinion regarding this thing, because it was mainly his patient, and he told him that you can have normal intercourse. Now we can understand that the reconstruction of the bladder has been done. There is nothing wrong with the testes, with the penis, with the channel, that is the urethra, and therefore why should he not be able to have normal intercourse? He was having erections also, and therefore he was permitted to have normal intercourse. So friends, this was a very interesting case for me. I did not know much about this type of thing because it is basically a surgical problem. To me it came only because the patient was having tuberculosis, and once I started the treatment, the patient felt happy and he continued the treatment. So friends, next time we will pick up some other interesting case, and thank you very much for your support which you are continuing to give me in the form of subscribing my channel as well as commenting on the videos. I am especially thankful to those who are regularly commenting on this thing. Some of you may think that once you have subscribed or commented, that is sufficient. Friends, I am making regularly about 2 videos in a week just to spread medical knowledge. And if you do not comment on every video, and you do not open up, even some people do not open the link also, that is just wastage. And I may say here, though I am very sorry, but my Facebook friends are those only who are interested in learning and gaining knowledge. And if you do not open the video, what is the use of my doing this much effort? So friends, do open it, otherwise I will be forced to remove you from my group as well as my friendship list. Thank you very much. We'll meet next time with another interesting case.